So Dr. George Abraham earned his medical degree from the Christian Medical College in Ludhiana, India, completed his residency and chief residency at the Saint Vincent Hospital in Worcester, and received a master's degree in public health from Johns Hopkins School of Public Health. He is board certified in internal medicine and infectious disease. He is a professor of medicine at the University of Massachusetts Medical School, chief of medicine at Saint Vincent Hospital in Worcester, and adjunct professor at the Massachusetts University of Pharmacy and Health Sciences. He has served as president of the Worcester District Medical Society, president of the American College of Physicians, as well as chair of the Board of Registration in Medicine in Massachusetts. He has also served in leadership roles in the Infectious Disease Board, the Health Foundation of Central Mass, and as Chief Medical Officer of Central Massachusetts Independent Physicians. Dr. Abraham, let's talk about your interest and experience with regard to justice and equity and diversity. You've expressed a particular interest and indeed edited a issue of Worcester Medicine recently about that. Let's talk about that a little bit.
Yeah, thank you, Dr. McGee, first of all, for having me here and for your very kind introduction. So justice, equity, diversity, and inclusivity is something that's really caught on recently. And as an immigrant physician myself, and having gone through the experience of translocating to another country and integrating myself into a new system, and to be in practice now for 3 decades or so, this has been something that's been a burden on my mind, especially because we see such a diverse population in the people we serve, as well as in our own peers and the physician community in general. And so justice, equity, diversity, and inclusivity is really a concept that we have learned right from our medical school days, where we talk about the Hippocratic Oath, and we say that we provide equitable care to all our patients, and that we serve them irrespective of caste, creed, color, or their ability to pay, etc., all of which are sort of inculcated right from our entry into a medical career. And when I was the president of the American College of Physicians, I was asked to pick a theme that I wanted to use for the year for all of my conversations and my monthly newsletters, etc. And I chose the particular aspect of inclusivity because justice, equity, and diversity had reached a fair degree of conversation in all major professional societies at various spheres in our practice. But inclusivity really focused on me as an immigrant and the immigrant physician population, as well as the immigrant patient population, to say, how could we focus on bringing them into the mainstream? And so the best description of inclusivity that I'd heard is from a person called Verna Myers, who is a TED Talk host and speaker, as well as has spoken much on diversity. And to the Cleveland Metropolitan Bar Association, she was once invited to speak, and she described it this way when she said, diversity is being invited to the party, inclusivity is being asked to dance. And so really takes it to the next level, a paradigm shift where we really integrate people into, not that they're just invited, but really integrating them where they're really asked to dance, which means they're as much participants in both, whether it be as a patient in their own care or as a fellow physician in the physician community. And so through the year, my goal was essentially to focus or spotlight inclusivity. Obviously, my lived experiences helped inform some of those content, and then my reading helped me to become a better educated physician in that area. And inclusivity spreads across from gender diversity to being a he for she, to recognizing gender orientation, and to recognizing ethnic diversity, and many different ways, our backgrounds, cultural diversity, so many different aspects, and where inclusivity could apply in every sphere of our work.
Wow. So you have achieved so much, and you are an immigrant. And so can you comment at all about the barriers you encountered and how you dealt with it?
So I think definitely coming in as an immigrant physician, one has to prove oneself, or to establish or to demonstrate that one is equal to one's peers having trained in a different country. And obviously that can vary depending on individual experiences as well as one's background. I had the fortune of having worked in a couple of different countries before I came. I had some training behind me. And so probably my integration was a little more seamless or easier than probably some of my peers who might have struggled more. I also came at a time when it might not have been much of a challenge, but clearly I had my share of when I applied for interviews to programs and was turned down because I was told that there were qualified physicians or better qualified physicians than I was, etc. So I had to swallow my pride, swallow my disappointment, but help integrate into a system who was accepting. And then as I integrated into practice and started working again, the same as you try to rise up the ladder in many different spheres, the same concept of, there are others who might be better than you, which I took to be a constructive criticism and use that as potentially a way to say, where could I be better and in what areas could I be better? But once I reached a point in leadership where I thought I was at the helm of a major organization such as the American College of Physicians, which is the largest internal medicine specialty society in the world with over 160,000 members. That was my time to really say, if I had barriers, I would much rather like that we are able to break down some of those barriers. And so we really started as a college looking at the whole concept of DEI, but particularly about inclusivity. And I'm proud to say that at the end of my year, we had developed an international medical graduate task force, which really focused on the needs of the international medical graduate physicians, both as trainees as well as practicing physicians, saying, how can we better integrate these people into the community, as well as how can we be better sensitized to the diverse patient population that we are all fortunate to take care of and from whom we can learn much.
Mm-hmm. And in serving the population of Worcester, what changes have you observed over your career?
I think definitely the acceptance of diversity, pardon me, but the acceptance of diversity, the fact that we have population, our patient population hails from different backgrounds, different cultures. They bring those unique attributes, but it sensitizes us also to be mindful of specific cultural needs that might be things that we need to factor in, whether it be end-of-life care or talking about palliative care or talking about goals of care or talking about things like how do you deal with the death of a loved one and what happens to the person, and if they have specific religious rites that need to be conducted, how we are respectful or mindful of that, people's dress attributes, people's linguistic attributes being different. I think we become better physicians when we learn from them and learn that that diversity makes us a better educated physician because we better understand people's needs. And so that it increases our empathy as well as our sympathy in situations. So I think I've become a better person by being able to take care of such a diverse community. I think I'm more sensitized to the fact that costs, affordability, and other challenges, the social determinants of health that we talk about often, and the interplay of that into medicine, and the fact that our care needs to be focused on those areas are all things that I have learned and continue to learn in my delivery of care, not only in my practice setting, but in the good fortune of having worked at the St. Anne's Clinic with Dr. Lockery and Dr. Claremont for many years, and now at the Epworth Clinic, where I occasionally help as well, where again, the same, we deal with a population that is often underinsured or uninsured, and the economic challenges that determine their ability to access care.
Mm-hmm. Excellent. And so you've basically taken your lived experience and the fact that you have overcome a lot of barriers and not forgotten the problems that you encountered in entering the profession and advancing yourself. You are also involved a great deal in education. And what opportunities do you see both in the education of residents and medical students as well as in the continuing education of your colleagues?
I think the same things that I wasn't as fortunate to learn in my own medical school, just because That was a different generation, and we weren't sensitized to these same areas then. But I think we are aware a lot more now. So we have tried to incorporate that into our curriculum, whether it be gender diversity, gender orientation, looking at disabilities and how we deal with those situations. How do we deal with social determinants of health, and how do we deal with people struggling with access to care? How do we deal with discrimination? And so lots of different facets. And so we are fortunate that now we are able to call on subject experts. There's a fair degree of content in the worldwide domain that we can access. And so we've enhanced our own curriculum. We've developed modules that all our trainees go through for the same reasons, because this will inform our delivery of care and should inform the delivery of our care for the next generation, as well as for the rest of our career. And so it's critically important that all of us be not only sensitized, but be educated, since a lot has been said and learned about that we could really use. And so I think I've become a better physician, and I hope I continue to remind myself and continue to practice these wonderful concepts that I've learned.